Thank you so much for that background about beyond therapy, catalyzing social transformation for overall well-being. It's a very interesting, important topic, and I'm joined by a wonderful group of people. Let me just give you their names as we start. Olga Shibanova from Slovakia. Christoph Raos from the Philippines. Chitra Sabesan, now in the US. Paya Wu from Laos.
Oh, I'm from Minneapolis. It snowed. I'm glad to be here.
All right. And I'm Sandeep Nath. And how we're going to conduct this is we'd like to have participation from the audience. So if you feel like interjecting at any point, feel free to just raise your hand and we welcome that. But otherwise, we're just going to start with a few questions. And I'm going to start with the first one for Olga. And I think it's a logical question to get started on this subject because, Olga, the question to you is, first, let me introduce Olga in a little more detail here. You know, Olga is a healthcare visionary dedicated to promoting health equality through digital transformation and personalized healthcare innovations. As a co-CEO of AI Dental, see, AI and dental come in the same sequence. She leads efforts to revolutionize dental education with AI-driven solutions. Olga spearheaded initiatives like Health Clip, empowering patients to digitize and manage medical documentation, reflecting the European health data space philosophy. With a diverse background in law, global health project management, and digital innovation, she brings a holistic perspective to European health systems. Her experience spans leadership roles in startups, UN, and NGOs, as well as shaping digital health policies in multinational companies. Olga is also a coach and has taught entrepreneurial leadership. So that's a wide spectrum of stuff. What impressed me most was AI and dental coming together, God. So Olga, what comes first? Building a mature society and then a system for it, or motivating society to mature by providing the system that makes a mature society? Let's get you on that. Thank you.
Yeah, I hope we digested the question, indeed. But basically, when I was thinking about this panel and what it means to me, and while we are discussing the innovative policies or how we want to change the healthcare systems and what we are doing for that, because obviously a lot of us are doing a lot of things on different spectrums, how to reshape the current healthcare system globally, I was thinking whether the society is ready for this change, meaning that we can bring very amazing policies. We can create very good innovative solutions to the healthcare processes, to clinicians or to patients themselves and so on. But then the question stands still, once we do it and once we implement it, whether people are actually ready for that, whether they're going to use it and whether it's going to bring the impact. Which leads us to the question or to the thought process, what we can do to enable society to mature or to raise in order to accept those changes and to understand that that's for our human benefit. Because no wonder I'm also a founder of Philosophy Club, so that's also where it comes from. But I was thinking that we as human beings, we evolve also as a society like a child, right? We have some early stages of our development, then we get into teenage ages, then we get more mature, and so on and so on. So where are we as the society? Are we ready already to take full responsibility for our health and for our lives, and then to actually utilize the innovative systems, policies, and innovations into our daily life? So I don't have the answer on this question. I can philosophize all day on that, but just wanted to open maybe also with that philosophy touch point a bit.
Would anybody in the audience like to offer any thoughts on this? Chicken or the egg? Please.
Well, thank you very much, actually, for having this topic. Mental health and well-being definitely is very well related, right? And I was discussing with my group colleagues before lunch how we view mental health and how we view exactly that approach. As you said, it is very difficult. Is people ready? People is ready if we present it the right way, right? I understand that all we've gotten as a society, it is exactly that view. If I have a mental health issue, I'm not okay. And what do we picture? Somebody throwing rocks, somebody hitting somebody on the street, right? So the mentality has been presented, though, by the movies, by the Hollywood, by the social media, right? What do we see in a movie? We see exactly a psychotherapist sitting there and scraping on his notebook, right? And asking the same question over and over. How do you feel? How does that make you feel? Well, personally, I have gone through depression, and when I sat on the other side, I felt like nobody's listening, nobody freaking cares. You know, and the whole point is that I'm here because I need you, right? And us individuals, if we do present that, if we correct that, it's not actually a philosophy. It is human behavior, how we accept things. It's for what they're presented to us. If it's simplified, that it is okay. Mental health, it means your body, your soul, your mood, everything is together. That's what mental is, right?
Yeah.
So
Thank you.
it is, thank you very much, guys, really for bringing this topic up, and I hope that this conversation will get farther and we can have more discussions about it, because it's an amazing topic.
Awesome. Well, unfortunately, we have only 45 minutes on this panel, but we'll keep taking that up. Olga, I'd like you to roll it
Okay.
forward.
Thank you. So I'm going to introduce the Dr. Christopher Rose, who is the licensed mental health counselor in Washington State and founder of Evolve Care Counseling, dedicated to helping individuals, children, and families heal and thrive. With a PhD in psychology and certifications in trauma and neurodivergence, sorry, he specializes in ADHD, emotional regulation, autism, anxiety, depression, and PTSD. Dr. Rose integrates CBT, mindfulness, EMDR, hypnotherapy, and VR therapy to help clients unlock their full potential. His approach fosters deep healing by combining innovative, evidence-based techniques with a safe, empowering space for transformation. He's passionate about mental health advocacy, and he works to expand access to care and destigmatize therapy. Yep. So I have, yes, that's, well, you do a lot of work indeed. And I have the first question for you.
Yes.
So with the rapid advancements in AI and technology, what innovative solutions do you think will be essential for supporting others in the future?
Thank you for the question. Seeing how we're advancing so much with AI, we can incorporate so much information, even with the information that we get from different type of smartwatches. Was that Ring that people are using, that Aura? You can incorporate so much data from that, and so going from there, we can adapt gamification. Because a lot of things that I have been seeing within my own practice is the current generation, well, they kind of lack resilience. They lack follow through with a lot of different things. And so it's developing the positive habits that you can go through gamification, where you encourage more engagement, self-improvement, and built into all this is progress tracking. Now, we have really great programs right now. Habitica is a great one. There is another one called Breezer, which is a weight loss program. Follows through with the same kind of gaming mechanics that you would see, and it takes all the information that you do from working out in a day and give you points, and you can spend it within the game itself. incorporating different other stuff of biofeedback. We're doing so much better, making things more affordable, like with neurobiofeedback devices like Flow Time. You can learn different ways of how to get into different meditative states. You can see different wavelengths of looking from alpha, beta, theta, gamma, delta, and learning how to master those states. And then incorporating a lot of this other stuff too is we're going into the stage in our evolution where we're incorporating so much other technologies that we can take advantage of. VR therapy. A lot of the things that I have at my own private practice is helping kids that already have a hard time engaging others and then providing the virtual environment to engage other individuals. And what's really great about that, because the current platform I'm using right now is XR Health, and it actually comes up with cues of how to address certain situations, even bullying. That seems to be a prevalent issue that we have right now. And then later on, as we develop, looking at how we can adapt augmented reality. So we've been seeing a lot of stuff on Facebook ads. I've been seeing these different variations of sunglasses that have like little pop-up screens that when you look through it. And it's really interesting of how far we can take that to the next level. So a lot of times, even with all the technology and advancements, I kind of want to bring it back to different forms of like mindfulness, self-regulation, emotional regulation skills, developing a higher sense of resilience in our society that throws obstacles in us, and then pushing through. So,
Thank you.
no problem.
Will you roll it forward?
I'll move forward, okay. I'm introducing Chitra Sabbesan. Chitra is a Canadian and British-trained healthcare leader, principal consultant, and CEO of CS Care Solutions. She also serves as Director of Quality and Chief Privacy Officer. With over 25 years of senior administrative experience spanning Canada, Qatar, Brazil, and China, she has led transformative initiatives across the health and academic health science sectors. Chitra is passionate about building bridges, collaborating with healthcare partners to improve care transitions for vulnerable populations and nurturing minds, advancing inclusive teaching and learning for the next generation for healthcare leaders. She has served as an executive board director for multiple organizations, is an accreditation surveyor, and a published author in respiratory therapy practices. She also writes and illustrates children's books focused on themes of bravery, self-advocacy, and maximizing potential for children with mobility, breathing, and communication challenges. Very impressive. So my question for you, what are the gaps in traditional healthcare and how have you overcome it?
Thank you so much for that question. There are so many challenges, right, in healthcare. My last position prior to me moving on to taking on the Director of Quality and Chief Privacy Officer, I was actually a clinical director for one of the largest regional hospitals, overseeing pediatric psychiatric ward. I also had the emergency department. I also had a foot in the community for one of the community organizations that provided services for clients with mental health conditions. So one of the things that kept keeping me up at night is how many patients came through Emerge and they waited and waited for services. Some of them turned around. It was a regional hospital. And the wait list just became so huge, particularly for things like eating disorders, because there's always an underlying mental health issue for a lot of these children, but not addressed. So one of the things I did was really reflecting and talking to people, particularly in primary care and in community care, to see what their experiences have been. Because when we talk about well-being does not begin at the hospital. It's there to treat people when there is a crisis. Well-being is initiated in the community, at home. So what can we do to sort of strengthen that? Strengthen the capacity within our sort of community agencies, and plus, within the family circle. What are some of the things? We are never treating a child. We're actually treating and providing services for the whole family, so that they're all, doing the same thing. The goal is the same, that sort of a thing. So one of the things I did was, actually, when I found out that healthcare is so reactive, certainly not preventative, there's so many fragmented sort of care, processes with poor outcomes and barriers, particularly for underrepresented groups. Where are they? Don't tell me that they don't need mental health services. Where are they? If not, if anything, it's more prevalent amongst those groups. So those upstream efforts is what I'm talking about, the prevention. So one of the things I did was actually put together a think tank and brought a lot of the community organizations together across different territories that supply patients or refer the patients to the hospital. Some of them even say, we don't have capacity, just drop by the emergency department of the hospital, they'll take you in. When that child or that youth or that teenager doesn't need that level of service. So through partnership, we actually proposed a model, a business model, and got funding to actually create a pathway from the hospital's outpatient unit for particularly, we started with eating disorders. Particularly with COVID-19, the prevalence of eating disorders went up. And it's mostly girls, but we were also starting to see boys being involved in that eating. And there's several layers of complexity when it came to eating disorders. So creating a pathway from the hospital to the community where there was a triage option. Some children had to be treated in the hospital because there were many underlying psychiatric conditions. However, there were many others who don't belong in the hospital setting, but the treatment could be provided in the community setting. So that care pathway has been created, streamlined, lots of PDSA cycles to ensure that, we are meeting the needs of people. One of the most important things in my work is to bring in the lived experience voices to the table. What's going well? What are your experiences for those who are receiving the services? And what can we do better? So 3 years later, it's still going strongly. We have a little home. It's set up like a home for the eating disorders. So really happy about that. And the other piece, the second sort of tier to this, is patients who come through Emerge. But how can we immediately provide that de-escalation, which is what they need, provide the families the top maybe 3 things that they need to know if this were to recur, and then send them home with an appointment in their hand. So in 72 hours, in less than 72 hours, somebody will call you because the appointment has been made, so that they are now set up in the community to strengthen. So well-being actually starts in the community. We need to push it back there, build the capacity within the community, because that's where it needs to be.
Beautiful.
Mm-hmm. Over to. Thank you. Okay. So I have the great privilege to introduce Paya Vu. She is the founder of Your Own Pathway. She's a social worker by background, turned psychotherapist, and has now transitioned to empowerment life coaching, organizational leadership consultant, and embracing the life of being a content creator by hosting a podcast called Owning It and YouTube channel Your Own Pathway. Her intention is to help individuals, people, and organizations forge their own path by helping them rebuild their foundations that align with their values, ethics, and beliefs so they can proudly own it. Wonderful.
Thank you. I never thought that I would be saying hit the like and subscribe button, never in a million years, because I had a real job and being a YouTuber is not a real job, but now I have that job, so it's a real job now.
It's an amazing thing that you're doing. I do have a question for you.
Yeah.
And it goes like this. What are some of the barriers that may, in your experience, that may have prevented someone from forging their own path? Through your, everyone that you've seen in your own experience, what are maybe some of the top 3, 4 reasons?
Yeah, so you're a psychotherapist, and I'm a psychotherapist, and like a typical psychotherapist, we go all the way back into your childhood. And so I would ask, how many of you are doing jobs that you said that you were going to do at 5 years old? Like, are you that astronaut? Are you that brain surgeon? Whatever, or, whatever job. How many are doing the job that you said that you would be doing at 5 years old right now? Raise your hand. Okay, nobody is. And why? Okay, one person. And what did you say that you were going to be at 5 years old?
I wanted to be in the medical field. I wanted to be like my mom, a nurse.
Oh, okay. So congratulations. And so you're a nurse. You said you were going to be a nurse, and yet why? A lot of us didn't raise our hands because I think we had a lot of hopes and dreams, and then as we grew older and older and older, and so you could be whatever you want. What's your name?
Loretta.
Loretta. You could be whatever you want, Loretta. And then you're like, yeah, I could be whatever you want. And then you hit middle school and high school, and your parents and your teachers and your coaches kind of say, maybe that's not the thing for you. It's like, I want to do this though, but it's like, no, that's not really your talent. That's not really your strong suit. So I really think you should try something. Your writing's not that great. You're creative, but it's not that great. And so people tell us that we don't have it. And so when we don't have it, we have to come up with a second, third, fourth plan. And then once you hit 18, 19, 20, real life hits. You have to adult. And when you're adulting, it's really hard, and you have to face reality. And everybody says, that's a nice dream to do art, but let's come back to reality, because art doesn't make money. Being an artist is, you're a poor artist. You're poor. You're not going to get anywhere. And so we have these thoughts, we have these ideas, and then we push away our dreams, our hopes. We push away that 5-year-old inner child that we had. And so we live in reality. And so because we live in reality, we have bills to pay. We have status quos that we have to meet. We have to check boxes. We create a life that makes other people comfortable. We're not living our true self because our true self makes other people uncomfortable. And so you go through life, kind of lost, and you're wondering, who am I? But you're so tired, you're so, you're in overdrive, you don't have time to do anything, and then you let go of all those dreams and hopes, and you're checking the boxes that society tells us to. You gotta fit in certain boxes because that's how they do data. And so if you don't fit in those boxes, people get mad. I think about that line. In school, how you're all supposed to line up. And when you don't line up, one kid yells and tells the teacher, it's like, oh, she's out of line. And you get in trouble because you dare be out of line, because you're not in line with everybody else. And so that's what happens when you grow up. Everybody wants you to be in line. Everybody wants you to be in data, so that's easy to count you. And so you start to let go of those hopes, those dreams, and then you lose yourself. And then when I ask my clients, who are you? They're like, I don't know. I'm a mom, I'm a lawyer, I'm a son. I'm like, those are roles, but who are you as a person? And that's such an easy and hard question. And they have this crisis, I don't know who I am. And so society kind of forces us to let go of our dreams. And it's finding that inner child again of who you are. So that's it.
Awesome. You can pass it forward.
Yes, I'll pass it forward here. And so I have the honor of introducing Sandeep Nath, who is a globally recognized thought leader, speaker, and coach, acclaimed for his work in bridging consciousness and commerce. A 4-time author, his book Renewal has inspired the renewalism movement, a transformative initiative helping enterprises build conscious cultures that drive sustainable and profitable growth, recognizing consciousness as a principal agent for societal transformation and overall well-being. Sandeep partners with mid-sized health institutions and hospitals to integrate energy-led practices for patient care and workplace well-being. A member of various boards, mindfulness and Qigong expert and international Reiki master, Sandeep has taken renewalism habits to more than 46 cities across 4 continents. So very impressive. So first question for you is, as a Qigong expert, Sandeep, how do you see this practice as a catalyst in bringing societal transformation and well-being?
Thank you. I'm going to start with what is Qigong, because in any audience that I speak to, less than 1% people have come across this word before. And I had come across it myself till I went to the Himalayas and learned from Tibetan lamas, a practice that's about 5,000 years old, which brings the body, the mind, and the spirit in alignment. And Qi is the life force energy, the spirit, and Gang is to work with. So Qigong is basically working with energy. And in this forum where we're talking about social transformation, and that's the important thing, I want to draw your attention to something you could Google up later. There was, in the 90s, a hospital in China which was completely based on Qigong practices. And they did every kind of procedure with 95% and above success rate, with no surgical interventions, with no medication. It was called the Medicineless Hospital, and the key word to search up Medicineless Hospital would be Hun Yuan, Hunyuan. So the Hun Yuan Medicineless Hospital finally ran into political problems and had to shut down sometime around 2002. But reviving that sort of a practice in society is what the potential of ancient Oriental wisdom is all about. And reviving those practices, renewing our society, the way we live and work, with that kind of wisdom is certainly going to take us far. It's something that is prevalent in the eastern side. You have parks in Singapore, in Malaysia, of course in China. You have hospitals, traditional hospitals practicing Western medicine, who are also doing Qigong practices. You're talking about communities. So, making a community practice of working Qigong for about 20 minutes a day gets the whole community in a different kind of a relationship. And when we experience such stuff ourselves and experience how we don't need to see a doctor anymore. I haven't seen a doctor in 20 years for an ailment. That's when it becomes part of our belief system and breaks that conditioning that keeps us where we ought to be or whatever. So bringing Qigong into mainstream is going to result in huge societal transformation. And another aspect of this is that about 8 times out of 10, the reason we visit doctors is something induced by stress, directly or indirectly. And stress by itself comes when the body, the mind, and the spirit are not aligned. What the body wants to do something, and the mind is saying something different. And that's when you're stressed. Do I do it? Do I not do it? Did I do right? All that worries and anxieties and all that come in. And then that manifests as something physical, and then you pop in a tablet. But if your body, mind, spirit are aligned with a daily Qigong habit, and no more stress. So that's kind of where I believe that would go. And I see that we are short of time. So Olga, if you'd like to post the next question to Christoph and keep it to less than 2 minutes, that'll be great.
Definitely, I'm happy to. Sure. So the next question would be, how can we empower individuals to take ownership of their mental health and well-being to drive meaningful societal change?
Well, behest of everything else, I think, also from personal experience and helping other clients along their journeys in life. Seeking, it's more like how we conceptualize of how to get help, right? It's destigmatizing of how we see mental health and seeing that seeking help is not a weakness. It's like having to promote a culture, creating better policies that helps individuals want to go out and become better. Providing better education about like how we deal with mental health. I mean, we do pretty good in America introducing a lot of coping strategies. I see a lot of kids that come into my practice, and they have a lot of foundational skills with mindfulness and training, but it's not practiced a lot because it's not cool. So, like, we have to do a different stance of how to approach this as a society that builds a positive net worth for everyone else. So it's like, I'm a big fan of Qigong, mindfulness training. I'm a huge martial artist fan. All these parts that we have in our society, we have access. But if we can get like a larger stage of trying to get more influencers to promote these a lot better, going from the social media aspect of it and promoting it through our communities, and we can see a bigger change within society itself, and then like with everything else, AI can help out with that process too by integrating so much information and see the trends and how to push for those trends to help push a lot of mental health awareness, better mind-body connection, and seeking out services when needed. I'm hoping that was under 2 minutes.
You have a question for Chitra?
I do. Chitra, what is the critical to catalyzing societal transformation for overall well-being?
Well, that's really power-packed question. But, as I had mentioned in the first, part of my response, there's a lot of things. The society needs to be involved. One thing that you had said, Chris, is with regards to stigmatization, right? It still exists in a big way in the communities. The other pieces that we don't really have a lot of time to speak about is homelessness. For youth, where do they go after they come to the hospital? It's creating those transition pathways and stability within the community. What about jobs, for them, so that they can continue to integrate? But who does that, right? Who's responsible for ensuring that our youth can have a sustainable future? That's why I'm on the board of directors for one of the organizations that does exactly this, that the Youth Justice is also under that. So I learn a lot from the individuals that are part of that system. So there are so many, but so self-advocacy is one thing I want to get started with. So important, and again, it's multifaceted. You can say you can do so many wonderful things in life and whatnot, but they need to want to believe it. So how do you make it practical? How do you continue to mentor these individuals, ensure that they have the right peer support as well? People who've graduated, who've done really well, can they come back and provide these sorts of, mentorship, and to tell people that I went through that and I'm just 2 years older than you, that sort of a thing. And so really creating those platforms is important. I can talk till the cows go flying, but they won't believe me because I've not really had that experience that they have gone through. So they need to hear that from peers. The other thing is, for those individuals who have family, because not everyone does, and what's the definition of family, right? May come to mind as well, is really bringing the family unit together and learning together about what it is that your loved one is experiencing. What are the feelings, what are the thoughts, and how can we get to the root of that issue that exists? Food security, tends to be a really big problem as well. So again, that's a whole topic on its own. So self-advocacy, person and family-centered sort of approaches, and building that community partnership and integrating them back in the community is really important, and developing those transition pathways. So as part of leadership, you can look at legislation policy, you can talk to government, you can create those pathways, bring in lived experience voices to the table, because that sort of advocacy is, and the patient story, those playbooks that you use, is very powerful. It's underrated, perhaps underutilized, but really bringing the families to the table and really empowering them to speak out the experience. Everybody has a human heart somewhere. We get buried with so many, red tapes and whatnot. So these sort of things really help. So I just want to say that, if you set your mind to doing something and you've got a great, wonderful group of people, like-minded people doing this, I think we can get somewhere, but not without the support of government. So you need to have them on your side. So there are strategies to do that as well. I never say no to anything. I'm always there doing everything in my power, because it's every step that makes a difference.
Awesome. I invite the audience to one-on-one with you on the strategies. Over to Paya. Have a question for her?
Yes, I do.
Yeah.
I have a question for you.
Okay.
Sorry, I was just completely immersed in my in the depth of my ocean. So the second question for you, wonderful, building on all of the responses and in your enterprise and experiences. How can someone or an organization rebuild their foundations?
I think we talked about this all week, is getting to know yourself, taking time to really get to know yourself, what you want, and those are the foundations. Whenever you build a house or anything, you need a foundation, and so you gotta build from that. And so questions to really ask yourself, either as an individual or as an organization, is what is most important to you? What's not important to you? What do you like? Do you actually like that, or were you taught to like that? Do you actually like burgers, or did somebody tell you to like that? So, just really simple questions that I think a lot of us as adults, we don't take the time to consider thinking. And so when you are ready to rebuild your foundation, either as a person or as a business, start out with these simple questions. And what are your values? What are your ethics? What are your philosophies? And kind of go from there. And the best part about rebuilding your foundations is you can change anytime. It doesn't have to stick. When you build a house, okay, yeah, if you build a foundation that's not working, maybe you have to tear things down, but you as a person or organization have the flexibility to always pivot and change your mind if that no longer works for you. So just very simple questions to ask yourself and go from there. So I know I want to keep it on time here. So last question here for
Simple and very powerful questions.
Yeah.
Points.
So Sandeep, how does the renewalism movement help health institutions go beyond therapy?
Thank you. That's a good question, because there must be many of you representing health institutions here, and I'm going to keep it short so that we can invite a question or two from you. There are basically two aspects that any health institution would be looking at. One would be the patient experience. And just to recap, renewalism is about renewing consciousness, renewing the ancient Oriental wisdom and bringing that into life and work. And let's say now that we know a little about Qigong, which could be one of the renewalism habits, when we bring that into hospitals, for example, the patient recovery is much faster and the patients are empowered to self-care. So this really goes beyond therapies and goes into that aspect of well-being starts way before you enter the hospital. The other is the staff of the hospital itself. And, staff in all health institutions is very stressed. So going back to the concept of body, mind, spirit alignment and renewing oneself every hour of every day, there are habits for that. That would create a much better patient experience and a much happier staff worker. So it really runs deep once a health institution could adopt a culture of such practices. And then that apart, experiencing it for yourself, as I just said, when medical professionals have experienced these habits working for them, they break their existing conditioning, and that's how the whole movement moves forward into other people's domains, houses, offices, and wherever else. So that creates community, that creates connection, and that raises consciousness. And ultimately, we must remember that 3,000 years ago, even 2,500 years ago, we didn't have health institutions. Everybody took care of themselves. And that's because they connected much better with spirit. And let's renew that kind of concept. So that said, I'd invite any questions. We have a minute or two. Happy to take them on. Yes, sir, please.
I have a question about education. So you said everything starts when we are young, but when I look at my school days in Europe, at school we were taught to be silent. We also just had to listen to the teacher, and then at exams try to reproduce everything correctly so we would pass the math exams. I had, for instance, during my high school, 6 hours of Latin for 6 years in a row, and I don't know how this prepared us myself for life, actually. And so my question is, what can we do to prepare children during high school for life, really, for the roller coaster that life is, to be prepared, how to handle wellness and let's say, become happy? Yeah?
Fantastic. Paya, you want to take that one?
Wow, that's a really packed one. I'll do my best. I look at the kids that I have in my life, and I have nieces and nephews, and trying to prepare them for life. I give them the education, the compassion, and yet I also say, when you go out in the real world, sometimes not everybody's going to be nice or kind, but that doesn't mean that you have to be mean or be vicious or be anything because people tell you that that's how you need to be. And so looking at young kids, I think, especially now, and you work with kids, and so you see a lot of this, and I used to work with kids too, and I think I said this, like they're trying to be themselves, and then we're telling them they need to be something else. And so they lose that part of them. And so what would you say, Chris, to add on to that? Like, you work with kids.
I think it's about mostly just identity.
Yeah.
Because a lot of kids don't know who they are anymore. They look through all these different individuals on YouTube, different types of social media platforms, and they want to be these people. What's surprising to me is a lot of the kids I've been dealing with, even teenagers, they expect to be millionaires by the time they get to out of high school, and then the crushing, realization afterwards, and then they have to rebuild themselves after that. So
They all want to be YouTube stars and TikTok stars?
They're really popular.
I can see Chitra and Olga all heating up to the mic. But to your point, there's only one thing that I'd say. If the principal allows it, we'll talk.
Just a minute. This is concerning our children. One thing I wanted to say is it's okay to tell your children that people fall, right? I think that's a reality that parents tend to mask. It's okay for me to tell my son or daughter that, how many times mom has fallen, but the important thing is how I was able to pivot, self-reflect, what am I supposed to do differently so that my outcome is different? And how did I rebuild myself to get to where I need to go? And then the second piece is, what are you doing in your power to contribute as a peer to someone who has less than you do? Because remember that, we are all on this one particular spectrum, right? But we are all human beings. We enter this planet with a certain, ticket, and we do have an end to it. We all do, despite what we've got. So it's really hitting home those reality pieces. And then you're humanizing them. You're hitting home that human side, that realistic side early on. Then my children, this is how I raised them. And they're humanitarians. They will get up, they will open the door, and they're very young. And they have done social services. And I never told them to do that. They found that this was their calling. And they learn, they fall, and we talk, and they strengthen, they become stronger than they used to be. And you keep moving forward. Because there are more obstacles in the way.
Pushing for resilience. Yeah.
Thank you.
Okay, thank you so much for having us.
Thank you.
Thank you all. Thank you for your participation.